Hello, everyone. We're going to be talking about the second portion of Chapter 3 that I call MRI of the brain. I'll be giving you information on how MRI works, a little bit of a physics, which will be very helpful to understand some of the images and how they're produced. I also have a couple of YouTube videos that I find very helpful. When we get to them, I'll explain them to you, and I'll encourage you to see those very short videos. It gives you a lot more information about MRI of the physics of MRI. Although I keep saying that this is not a physics class, however, I really think that we all need to know just a little bit about the physics of how these machines work at this point in order to understand the images better. So let's move on to the limbic system first, which is on page 117 of the book. This is the rest of chapter 3 that we didn't cover last time. So as we talked about the brain and the different parts of the brain, we started from the top and the cerebral cortex. We went to the corpus callosum, and then now we're going a little bit more in depth into the brain, literally more lower in the lower portion of the brain, or inside the brain more. One of the areas that's really interesting is the limbic system, which is a complex group of structures, and they have fiber tracts that are located in the medial surface of the temporal lobes. They have pathways which are very critical into sending signals everywhere to the brain, but particularly limbic system is involved with sexual behavior, memory, learning, connecting the short-term memory into long-term memory, and it's also for emotional responses. And there are several structures of the limbic system that are important. Hippocampus is one of them. So hippocampus, and in your book lists them this way: hippocampus, amygdala, olfactory tracts, fornix, cingulate gyrus, and mammillary bodies. And they're all shown in this picture. So you've got the hippocampus here. You have amygdala, which is this very tiny spot there. Hippocampus is right here. You have fornix, you have cingulate gyrus. This is fornix right here. Let's see, cingulate gyrus is here, this one, right? Mammillary bodies. One of them is shown here. The other one is on the other side. There are two of them. And I think that, and olfactory tracts. So olfactory tracts, the bulb starts over here and the tracts go all the way back. So those are the olfactory tracts. So the way I always remember limbic system is that remember when you were a child and you were at your mother's house, and maybe there was a particular thing that she always did. For example, in the holidays, she baked cookies. So the smell of those cookies has always stayed in your mind, in your brain. And now, after years and years, for me, after years and years and years of being a child, you go to another environment and you happen to smell the same kind of cookie. What does it remind you of? It reminds you of your mother's cookies and your mother's home and that environment. So that's what limbic system does. Because we have the olfactory bulb and the tracts there, limbic system actually connects that sense of smell to the long-term memory. And you can try that with anything else. Smell of a perfume reminds you of a certain person. Smell of a cologne of somebody reminds you of somebody or a place that you've been before. So I think it's really, really interesting and really good to know. Now, as far as the parts of limbic system is concerned, a couple of them are really important. One of them is hippocampus. So hippocampus is important because if it is damaged, it can actually result in loss of memory. And a lot of patients that come with dementia or seizures, they find out that they've had, after MRI or CT, they find out their hippocampus has been damaged. So really important. Fornix is also another area that's important, and it's an arch shape structure that is right underneath the splenium of corpus callosum. So those two areas, those two structures are important in limbic system. And also you need to know the function of the limbic system and how everything is connected there. Let's go to the second one. So this is another slide. This is an MRI that shows the different areas of the limbic system in an axial image, which you can take a look. Next one is the same scan. Also, it's the same area that was scanned. It is the CT image, obviously, and it shows the hippocampus, amygdala, and it happened to show also the ambient cistern there. So important to know these areas in both CT and MRI. Okay, let's go to the next section of the book, which is the brainstem. So before we talked about the superior portion of the brain, which was the cortex and the white matter. Then we said the posterior portion is cerebellum. And then we briefly, I think, mentioned brainstem, which is the lower portion of the brain. It's a small mass of tissue, but it has a lot of motor and sensory nuclei. 10 of the 12 cranial nerves actually originate from the brainstem. Brainstem is divided into three portions or three structures. You have midbrain, pons, and medulla oblongata for each of those. So this one is the, I want to say, anterior portion, anterior view of the brainstem, and it shows all the cranial nerves that come out of this. We will go over the cranial nerves momentarily, but yes, you need to know them, and you need to know them in order. Let's go. Second, this is posterior portion of posterior view of the brainstem. We were looking at anterior. This is the posterior view, again showing the different nerves coming out of it. Next one, we want to talk about the midbrain, which is above pons. It's at the junction of the middle and posterior cranial fossa. It is the smallest portion of the midbrain, but again, it has areas that are important for our function. I don't want to go into too much of the midbrain structures, the smaller structures of the midbrain. Let's go. This portion, which just shows you pons, where is medulla oblongata, where is midbrain, right, which is right there. And then let's go. The same area we're looking at, only on a coronal view, MRI coronal view, kind of showing you how the posterior portion of the brainstem looks like. Then this is axial view of the midbrain and cerebral peduncles. So if I didn't mention it, midbrain is actually divided into two major portions, cerebral peduncles and tectum, or quadrigeminal plate. So these are the two sections. This section is the midbrain and the cerebral peduncles. What you need to know about this section is the substantia nigra, which is extremely important. It's an important part of the midbrain, and it's involved with the production of dopamine. And if you happen to know something about the disease Parkinson's disease, dopamine has to do with increase of production. The production of the dopamine has been decreased. Okay, so when dopamine production is decreased, muscle spasticity, muscle spasm happens, and Parkinson's disease happens. So substantia nigra, so for example, if that portion of the brain or midbrain is damaged, or for some reason it's not producing enough dopamine, the patient may have Parkinson's disease. The opposite of Parkinson's disease is another disease called schizophrenia, which it's completely the opposite, meaning there's too much dopamine being produced in substantia nigra, and the patient has obviously completely different symptoms than Parkinson's disease. So substantia nigra is important to know. Okay. The next portion, which just shows you now the next section that we're going to talk about is pons. This one again shows pons, right, in an axial view. Pons again, only in an axial view in CT, so pons is now this area. Okay, now let's think about this case study that I have before I go into the rest of the brainstem. So you have a patient that comes to radiology department after motor vehicle accident. He's confused, doesn't remember what happened to him, but after telling him your name, he expresses your name is the same as one of his elementary teachers from years ago. So right away you know that he remembers something from the past. After the exam, he asks your name again. So within a short period of time, he forgot your name. What do you think? Which area of the brain is most probably damaged and why? So this is what you need to think about a little bit before I go to the next section. And I know you can fast forward this and find out what the answer is, but that's okay. So the answer to that question is the damage probably is done to the limbic system, because it has to do with short-term memory and long-term memory, specifically to the hippocampus. So that would be my answer to that question. Okay, so let's go into the different the other two parts of the midbrain, which one of them was pons. Pons literally means bridge. So it's a bridge between the midbrain and medulla oblongata. We've seen pons in different images, both CT and MRI, sagittal, axial, coronal, so you've seen enough of pons to know where. This is actually pons and cerebellum in conjunction with each other. So cerebellum, you know that it is in a posterior portion of the brain. It has two hemispheres. In the middle of the hemisphere, you have a, let's bring this up a little bit. You have an object that's called vermis. So vermis divides the two hemispheres of cerebellum. This is different than what we talked about before, the falx cerebelli. So it's different, don't mix it up. Vermis is actually a structure that's in the middle of the two hemispheres of the cerebellum. Okay, this again shows cerebellum and the vermis that's in the middle. I think I did not mention medulla oblongata. It wasn't intentional, but that, just so you know, pons, medulla oblongata, and midbrain are all part of the brainstem. So as I said, brainstem is divided into those three parts. And medulla oblongata basically extends from pons all the way to the foramen magnum, and it continues as spinal cord. I think we mentioned medulla oblongata before, and it's a structure that you should know from before. And then we get to see medulla oblongata better later on when we talk about the spine and MRI of the spine, when we talk about the spinal cord and so on and so forth. All right, so next is the 12 cranial nerves that you saw a picture of them coming out of the brainstem. There are 12 cranial nerves, 10 of them come out of the brainstem, the other 2 come directly from the brain. You have olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulo, glossopharyngeal, vagus, accessory, and hypoglossal. So these 12, you need to know them in order. So if I asked you what is the ninth cranial nerve, you should say glossopharyngeal. So now next to them I have their functions. You also need to know their functions as well. So make sure to memorize them and know their functions. I'm not going to ask you, show me accessory nerve on an MRI image. But we've talked about optic nerve before. You know where the optic nerve is. We just talked about olfactory a little bit. So those two that are coming directly from the brain, you should definitely know their locations. The rest, I'm not going to ask you where they're coming from, or if you need to point them where they are. So this is a good axial image of the inferior portion of the brain, where it shows all the different brain nerves that are coming from the different parts of the brain or the brain stem. Also, we talked about optic nerve before, so that's a good picture of CT. This also shows the optic nerve and how it operates, and how the two optic nerve from the back of the eye, they go in the back, they cross here at the optic chiasma. The left one goes to the right side of the brain, and the right one goes to the left side of the brain, and they both go to the visual cortex, which is at the cerebellum, or the occipital, it's in the occipital lobe of the brain. Okay. Next, again, another picture that shows the optic nerve really well, oculomotor nerve, trochlear nerve well. Get yourself familiar with these pictures. Again, I'm not going to ask you to identify these nerves in images. All right. So let's do a quick review here. Which arrow points to pons? I'm not going to give you the answers. You should already know them. If you have any questions, come to me and we'll make sure you get the right answer. Next one, which arrow points at thalamus? And we talked about thalamus and hypothalamus before. So again, you should know this one. You have questions, let me know. Pathologies that are demonstrated by CT. So before we get into the difference between CT and MRI, I wanted to mention the pathologies that have to do with CT. And you will hear these a lot. Although this is not a pathology class, I still feel that it's important for you to know these important pathologies. So subdural hematoma, hemorrhage versus hematoma, cerebral contusions, and meningioma. So these are the words and the terms, pathology terms, that you'll hear quite frequently. Let's look at this one, for example. So this looks like a subdural hematoma. So when we say subdural means what? Subdural means underneath the dura mater, right? And hematoma means there's some kind of a bleeding going on. Hematoma, and the difference between hematoma and hemorrhage is that hemorrhage is a breaking of the arteries and bleeding, versus hematoma is like a bruise. The bleeding has happened, now the bleeding stays there basically. So this is a subdural hematoma. So now look at this CT and tell me what you see different in this CT. Look at the mid section of the brain and how it's not symmetrical anymore. That's one of the first signs of something that's happened. Even if you were to ignore all this bleeding area that happened subdurally, you could not ignore the fact that the two hemispheres are not symmetrical anymore. Look at the ventricles. This is supposed to be the posterior portion of the lateral ventricle, and you can't even see that. It's because all the bleeding is pushing everything to that side, to the right side of the patient. So this is a subdural hematoma. To the next one. This is actually what we call subdural contusions. So contusions are bruises of the brain. You can get subdural contusions or cerebral contusions by if your brain was hitting the bones, the frontal bones or frontal skull. So this can happen in what? Motor vehicle accidents, right? If you had a motor vehicle accident and you hit your head to the windshield, for example, your brain is actually moving inside the skull and keeps hitting, the brain tissue keeps hitting the skull, and that can cause contusions. This is where injury to children can happen, which is also called shaken baby syndrome. When some adults who don't know anything about taking care of a baby start shaking the baby's head, because their neck and their head is very weak, the brain inside the skull starts shaking and hitting the bones, the skull bones, and this can happen. The cerebral contusion or shaken baby syndrome may have the same effects, may or may not go away, especially on children. If it's too severe, it can never be reversed. So it's very important. So this one looks like a, let's see what this one is. This one could be like another epidural hematoma or subdural hematoma that has gone a lot more inside the brain. So again, I am not going to ask you to identify these as much as I want you to really know what happens when there is bleeding going on inside the brain, whether it's subdural hematoma or epidural hematoma. Kind of know the difference between difference in the contrast of the brain tissue, which you can see here. There's more white. You would think there's bleeding going on right away. This is a fresh bleed. This is a bleed that just happened. So important to recognize these when you have patients on CT tables. All right, so now what's the difference? What are the pros and cons of CT and MRI in when we image the brain? Obviously, the pros of CT is the faster scan time, tolerance to motion, therefore you can put trauma patients in there, and it's relatively low cost relative to MRI. But some of the bad things or cons about CT is that it uses ionizing radiation. Most of the time we use contrast media, and then it gives you direct axial images only. Yes, you can do reconstruction and MPR and all the stuff we talked about before, and 3D images, but your direct views, your direct slices are axial. You cannot get direct coronal and sagittals from a CT. Whereas, so if I want to talk about good things about MRI, is that yes, it'll give you axial, coronal, sagittal directly from the anatomy. It doesn't use any ionizing radiation. There is no known factor biological effects of MRI yet, although we may find something that's dangerous. We still don't let pregnant women go into MR within their first trimester, and it takes longer. It has a very loud noise, and some people are claustrophobic with MRI. So all of those could be good and bad things about both CT and MRI. You just have to find out, or the physician needs to find out, what is the best way for the patient, and what's the best modality to use to diagnose their disease. If you have a trauma patient, of course you want to put them in CT first because it's faster. You can detect things faster and quicker, and then later on you can take them to MRI once you find out what's going on with them. Maybe the next day they can go to MR and find out what other damages have been done. But for the most trauma patients, we want to send them to CT first. So let's talk about, oh no, MRI of the physics. This is one of the YouTube videos that I have. It's very, very informative, extremely good for you to look at. But I am going to talk about MR physics also, just to give you a little bit overview of what's happening. You will learn about MR of the physics next semester, no doubt about it. in a lot more detail than I'm talking about. So the basics of MRI is really about hydrogen atom. Your body and my body is made of almost 70% water molecules. And water molecule is what? H2O, right? So what's the most abundant atom in your body? Hydrogen, right? And that's what we use. So the hydrogen atom is used in MR physics to produce images for us. So what we need is really hydrogen atom, which is abundant in our body. We need a magnetic field, we need human body, and radio frequency pulse. So these are the main structures of what makes MRI. So if you're looking at a hydrogen atom, just like any other atom, has is a little bit polarized, which means has a plus and minus. Now your body is full of these hydrogen atoms that are going every which way. They're spinning every which way. They're going into many different directions. Now if you apply a big magnet, such as the MRI magnet, that has these polarities plus and minus, and we actually measured the magnet of the MRI in Tesla. So most magnets are 1.5 Tesla, which is really 10,000 or 15,000 times stronger than the magnet of the Earth. Some facilities, if you go to USC, they use 3 Teslas. Some even use higher Teslas for research, but they don't put humans in there. But anyways, Tesla is the unit that we measure the magnets in MRI. So you bring a patient, you bring your person here, and you have them lie down in this magnetic field with this big magnet. All of these hydrogen atoms try to start to line up in this direction. So if you have millions and millions of hydrogen atoms, most of them, or at least 90% of them, will line up in the same direction as the magnet, the big magnet is. And they are spinning. So it's like a spinning top. Every hydrogen atom is like a spinning top, and it spins on its own magnetic pole. Once we put them in this magnet and we apply more magnetic field, this spin top or this hydrogen atom starts moving from one direction to another. When it moves to different directions, it gives off a pulse of energy. And that pulse of energy is the one that we measure and try to figure out which tissue is given off what type of energy, how much energy is given off, and so on and so forth. That way we can tell the difference between the different tissues that you see in MRI. So basically, that's MRI physics in a nutshell. And I understand it's not very elaborate, but when you see and look at those videos, you will understand a little bit better. So there's another YouTube video about MRI machine and how it works. Again, I cannot stress this enough to please go and watch these 2 very short videos, extremely interesting and informational. MRI frequency. So you know how we have different techniques that we use in X-ray. We have KV and mass and all of that. MRI is completely different from X-ray, but there are still frequencies, different frequencies that we use in MRI. They're called T1 weighted image, T2 weighted image, and then proton density, or SDW, which is spin density weighted. It's another name for proton density. But you'll see me mentioning, oh, this is a T1 weighted image, this is a T2 weighted image, and we're going to see what the difference is between T1 and T2. You've already seen them, actually. All the MRI images you've been seeing so far, they were either T1 or T2 weighted image. Some of them were proton density, but not many. But you've already seen many of them, and if you look into your books, you look more carefully under the picture, it says, oh, T1 weighted image, MRI coronal image, T1 weighted image. So we'll look and see what is what. So for example, you have a T1 weighted image on this picture. So T1 weighted image, and I think I have that on one of the outlines that I provided online, and it gives you really in detailed what does white matter, gray matter, CSF, and fat looks like in different T1 and T2 weighted images. The main thing you want to look at is the cerebrospinal fluid. So you have cerebrospinal fluid. Let's see, I want to, never mind that. I don't want to, oops. Now I can't get rid of it. Okay, never mind. I wanted to mention what CSF, where CSF would be, but I can just write it. So CSF, right? Where are the areas that CSF would be? Think about it. We talked about ventricles. We talked about cisterns, right? All of those areas, that's where you see CSF. So here's fourth ventricle, right? And there's CSF in it. Is it dark or white? It is dark. In every T1 weighted image, CSF will look dark. So that's one of the things that is obvious. Also, fat will look white on the T1 weighted image. So all of this around the skull is fat and it looks white. Let's go in a T2 weighted image. So on a T2 weighted image, which is really good, and it shows CSF, and it shows it also shows tumors and neoplasms really well. You'll see the CSF bright and white. So here's the right lateral ventricle, right? So you're looking at the lateral ventricle and it's white inside of it. That's the CSF. That is a T2 weighted image. That's the only sign that you can tell right now which one is T1, which one is T2. All around the brain, look at it. In the meninges, right? You'll see the CSF. So that is a T2 weighted image. Okay. Pathologies, the most important pathologies that are demonstrated by MRI, one of them is multiple sclerosis. Glioblastoma is another one. CVA, or cerebrovascular accident. Those are the strokes that happen, right? The stroke. And hemorrhagic diseases. These are bleeding. So, and for example, this is multiple sclerosis. Multiple sclerosis is a nervous system problem. It is when the axon of the neuron loses the myelinated sheath or the white material. On an MRI image, which this one, it looks like a T2 weighted image, you will see these white spots, especially around the corpus callosum. These white spots show are an indication of multiple sclerosis. Also, multiple sclerosis happens in younger patients, 30 to 50 years old. So that's how they detect if they see these white spots in an older, like somebody who's in their 60s and 70s. They diagnose it as degeneration of the brain. It's a normal degeneration. But on a younger patient in their 30s or 40s, white spots like this is definitely multiple sclerosis. Glioblastoma. So one of the worst kinds of brain tumors that anybody could have is glioblastoma. It comes from the glial cells of the brain. Look how much this tumor is pushing that it completely covers the left ventricle. You can't even see the left ventricle, and see how the midbrain has shifted that way. So glioblastoma, like I said, is one of the worst kinds. The worst prognosis of the brain cancer is glioblastoma. Within 6 months, the patient usually dies. By the time they diagnose this, the patient dies of the cancer within a few months, 6 months or so. And obviously, it could be a metastasis, or it could be a brain tumor that was generated from the brain directly. Rules of the thumb for searching for abnormality in the MR brain. Really, really important. What are the things that you look for when you look at an abnormal brain scan, whether it's MR or CT, it doesn't matter. So are the left and right hemispheres symmetrical? I've mentioned this a couple of times in some of the pathologies. That's really important. You want to see symmetry in the brain. Number two is, are there any areas that exhibit mass or tumor type enhancements? Are there any masses? Are there any tumors? Are there any areas that are not supposed to be there? And then number three, when you look at T2 weighted images, are there any other bright signals other than CSF spaces? We did say that the CSF spaces are supposed to be white. So are there any other areas of are white that they're not supposed to be there? For example, in multiple sclerosis, those other white spots were not supposed to be there. So that's an indication of abnormality of the brain. Okay. So I know that it says abnormality in MR brain, but really you can tell the symmetry happens in CT as well. The tumor type enhancement also happens in CT. Only the third one really is specifically to MR. So I can ask you, what are the 3 rules of thumb for searching abnormality in brain scanning? So, and you can tell me all 3 of them. Okay? The next, so the next 3 slides are basically questions for you to answer, and I'm going to leave them up to you. Answer the questions. If you have any problems with them, or you should know the answers. If you don't, let me know, and I'll go over. Functional MRI is one of the in one of the videos that you'll watch, YouTube videos, they talk about functional MRI, which is really, really fascinating. I need you to look at it and then answer this. And this is about MR physics board. And then that's it. And we're done with the lecture for the second portion of chapter 3, which was MRI brain. I hope you enjoyed it, and I'll be putting this recording on Moodle soon. Thank you so much. Have a great day.